Hey everyone, it's Michael again here, and I just want to say thank you and welcome back to our communication section for our home health aid and home care aid training certification program. So, what is communication? I'm sure you can answer this easily by telling me right now, but I want to be able to share additional information you should know about communication, both communicating with the client, the patient, their family, or communicating with yourself, or even communicating with your coworkers. So let's talk about and define communication. It's the process of sending and receiving messages through the exchange information with others. Now, to go even further, let's go ahead and talk about again. Communication is the process of exchanging information with others. It is that process of sending and receiving messages. Now, remember, people communicate with signs and symbols, such as words, drawings, pictures. They also communicate through their behavior. Effective communication is a critical part of a home health aide's job. Home health aides must communicate with their supervisors, the care team, the clients, the family members as well. A client's health depends on how well the home health aide, the home care aide, the homemaker communicates any observations and concerns to the supervisor, to the family members. They must also be able to communicate clearly and respectfully in stressful or confusing situations. Client may display combative behaviors, meaning violent or hostile behaviors, such behaviors will include hitting, pushing, kicking, or even verbal attacks at times, and it is unfortunate. It may be the result of an illness or even a disease. It may also be due to frustration, or it may just be part of someone's personality. In general, combative behavior is not a reaction to a caregiver. It should not be taken personally. Home health aides should always report and document any combative behaviors, even if they are not upset by the behavior. The care team needs to be aware of it. So you need to be able to know the three parts of communication process. Sender sends a message. Receiver receives a message. Receiver provides a feedback. Pretty much saying, the patient, let's say, says something to you, says hello. You then hear that, so that's you receiving the message, and you may decide to have a feedback by saying hello right back to them. So let's talk about this question. Who is the sender in the home health aide client relationships? Is it always the same person? No. The answer is no to that, and the reason for that is they may say something to you, but you may say something back to them. Either or, communication is a two-way street. It must come from both sides. We just need to be understanding at times that the person we're caring for may not be able to receive the information correctly or understand it fully. We may have clients that we're working with that has some disabilities, that has diagnosis, that had a stroke. And being able to communicate well is not good already. It may be difficult. So, looking into some of the terms that we're going to be facing in this chapter, verbal communication and nonverbal communication, as well as culture. Verbal communication is communicating using words or sounds, spoken or even written. Nonverbal is communicating without using the words. Culture, on the other hand, is a system of learned behaviors practiced by a group of people that are considered to be the tradition of that people and are passed on from one generation to the next. Now, we have to understand also this. When we talk about body language, this is what we're talking about, nonverbal behavior. So if we talk about the verbal and nonverbal, okay, we need to understand the differences. Now, just as with speaking, body language sends messages. Okay, the previous one that we showed you, let me go back really fast. And what does this body language tell you? Does this person, if someone sits like this in front of you while you're talking to them, while you're trying to be energetic, how would you feel if somebody just was slouching in front of you, not paying attention, just showing that they're detached from you? It's not a good feeling. And at the same time is inside, it doesn't feel right for you. We have to understand in communication, 7% per studies is the verbal aspect, the words that we use. Yet we feel that this is 100% of communication. The nonverbal, the how our tone sounds, how our body language looks may affect the communication, and we need to be aware of this. So how is your body language a form of communication? Well, easily. It shows interest or disinterest. And sometimes you may not even know that you're doing something, that you're actually communicating with a person. There are people out there, if you're talking to them and you have your arms crossed, may feel or may take that you are showing disinterest to the communication. If you looking at your watch every time that somebody's talking to you, the other person may feel that you're looking at the time and it feels like you're wasting their time, or they are wasting your time and you just want to leave. We need to be able to make sure we understand our body language and know that we may be delivering the wrong signal to another person. Remember, nonverbal communication may depend on also personality or the cultural background. Each culture may have different knowledge, behaviors, beliefs, values, attitudes, religion, and even customs. So how does your cultural background apply to the following aspects of your communication style? Distance from the other person, that, this is my personal bubble, right? If somebody crosses that bubble, am I gonna feel threatened? Some people are a little too touchy, depending on the culture, even depending on the person. You have that touchy-feely person that they just keep on touching you, patting you in the back, whatever they're doing, it just makes you uncomfortable. So if you're a touchy-feely person, you have to understand that maybe the other person might not like that, or maybe the other person might take that in a wrong manner. Eye contact is also another thing. You have to understand that culturally there are people out there who will not look you straight in the eyes. But then in our culture, in American culture, for example, if you're not having eye contact with a person, that's you showing disinterest, and that's showing that you are either scared of the person, you can't look them in their eye, and that also may show distrust or somebody who doesn't feel that they're of your level. So how can a home health aide use observation as a form of nonverbal communication? Well, you can see, and if the person feels, or the person is kind of detached, they're not wanting to look at you, or they are feeling that, that they're showing that closure, that disinterest, not paying attention, there may be a reason that either the patient doesn't understand what you're trying to say, or maybe at the same time is they have disinterest. They don't want to hear the problems. They don't want you there. They don't want your services. We need to be able to make sure that we pay great attention to that. We also need to avoid any cliches. Okay, we need to avoid cliches, which are phrases that are used repeatedly and do not really mean anything. Okay, we need to be able to watch those things because that can get annoying for some people. So barriers to communications are needed to be understood. So let's talk about barriers that's going to face. Whether the client does not hear correctly, or does not even understand. If that's the case, face the client. Speak slowly and clearly. Do not shout, whisper, or mumble. Speak in a low voice using a pleasant tone. For a lot of clients who are actually hard of hearing, you talking really loud can actually distort what you're trying to transfer, what you're trying to tell them. The client is difficult to understand. Is this going to happen? Sure. You need to be showing them patience. Okay? Be patient and take time to listen. Ask the client to repeat or explain the message. State the message in your own words to make sure you have understood. Sometimes just repeat what you think that they said. So are you telling me you want me to buy this? Are you telling me that you want me to prepare that meal? By you saying what you think you heard, if they say yes or no, that lets you know that you understood them. And it makes another person feel good. The home health aide, client, or others uses words that are not understood. Do not use medical terminology with clients or their families, because they may not understand what a congestive heart failure is, or a CHF, or what is pretty much a blood pressure, or what is, for example, a diabetes insipidus, or a diabetes, anything pretty much. I mean, there's so many different things that a lot of clients cannot understand. There's just so much medical terms out there that we overwhelm people that they don't understand. We need to be able to speak in their level. Okay? If a physician starts talking more medical terms that we don't understand, that may make us feel different. So we need to be able to communicate in everyone's level. Don't call it a sphygmomanometer, call it a blood pressure cuff. Okay? Don't say that they're having angina, just say that they're having some chest pains. You want to be able to use and communicate words that another person can identify with. Also, avoid any use of slang or profanity. Avoid using slang words. Not everybody understands what slang words are. They are unprofessional, of course, and may not be understood. So make sure you do not use slang words, and of course, no profanity. Now, HHAs using cliches are also not good. Cliches are those phrases that are used over and over again and do not really mean anything. For example, everything will be fine is a cliche. Okay? You can never guarantee that everything's going to be fine. Alright? So instead of using a cliche, listen to what a client is really saying, respond with a meaningful message. Now, also avoid using why as a response. When a client makes a statement, why questions can make people defensive. Say something where, tell me more. Tell me the reason why. Not just saying why. Tell me why. Tell me why. Does that get annoying? Of course it does. So, I can see what you're saying. Can you explain even further for me, please? Why you made that decision? Rather than just saying why. Now, also, HHA giving advice. Okay? So do not offer your opinion or give any medical advice. Don't say, well, my grandma had that feeling too before, and so this is what she did. You, as a home care aide, cannot give any medical advice. Okay, so you're not a doctor, you're not a nurse that can communicate with that patient properly in regards to those things. Now, the client may speak a different language. And with that said, that may cause difficulties for you. So if they speak a different language, speak slowly and clearly. Keep your messages short and simple. You may need you to use pictures or gestures to communicate. Now, if you speak a different language and the client you're working with does not speak the language you speak, avoid using those words. Avoid, of course, talking to another person with your language. Because that may cause some problems. The client may feel that they're being singled out. The client may feel that you're talking about them. So we want to be able to pay attention to our language, what we speak, how we speak. If your boss or your supervisor calls you on your phone and you answer and you guys speak the same language, don't use that language. Use the language that the other person identifies with. Now, the home health aide or the client using nonverbal communication. Remember, nonverbal communication can change a message. Be aware of your body language and gestures. Look for nonverbal messages from clients and clarify them. And we actually have a full nonverbal course that we provide, and we hope that you attend that one of these days. It's very important that you guys know your nonverbal skills. Remember, 7% of communication is verbal per studies, and 97% is nonverbal, meaning your tonality as well as your body language. So, if that is 97%, we need to do a little bit better and learn proper way of communicating that way as well. All right, so what are the slang expressions that you use or that you hear others use? Now, bling nowadays, everybody knows, okay? But there's other slang words out there that we need to avoid using, okay? Because a lot of people will not just know what to do or what it means. So let's list ways to become a good communicator, okay? Remember the techniques or the following techniques that's going to ensure that you are sending and receiving clear and complete messages. You want to be a good listener. Listen first, understand it, then provide feedback. You want to be able to bring up topics of concerns. Remember, do not diagnose them, just bring up topics of concerns. Allow pauses. Don't just nonstop talk for a good 5 minutes straight and don't allow the person to talk back or give you feedback. But at the same time is you want to pause. You want to be able to give that quick pause, and you don't want to talk really, really fast to someone if they talk really slow. We need to be able to deliver it clearly and positively. Okay? You need to be able to make sure that communications aids are clean and work well. When we're talking about our hearing aids, for example, if a person has hearing aids, make sure that they have a hearing aid when providing care. Make sure before you put the hearing aid that the batteries are there, and make sure that the batteries are actually working. All right? Here are additional strategies for effective communications. You also want to avoid changing subjects too much. You don't want to just segue right away elsewhere. Stick to the topic. Never ever ignore requests. Never ever talk down to a client, to a patient, or to anyone. If you're communicating, sit near them. Okay? If the person is sitting down, sit with them. If the person is sitting down and there's no chair to sit next there, you want to be able to crouch down and be in their level to show that there is an evenness with that. That's a very good nonverbal technique. You want to be able to approach the speaker. If they're talking and you can't fully hear them, get closer. And also you need to show empathy. You need to show empathy to any person that we're communicating with. That is very important that we have. Now, let's talk about the differences between facts and opinions. It is important to understand the difference between facts and opinions. Separating facts from opinions will make you a better communicator. A fact is something that is definitely true. Example of a fact, Mr. Ford has lost 4 pounds this month. Fact, they lost 4 pounds. An opinion is something someone believes to be true, but is not definitely true or cannot be proven. Example is, I think Mr. Ford looks thinner. Maybe it's light. Maybe he's wearing a black sweater this time. It's a fact if we can measure it, if there's proof that something happened. Okay, let's start looking a little bit and looking into some medical terminology and some approved abbreviations, okay? Because you may face this. Cyanotic, if you ever see this ever happen, if you may get this little question, is the patient cyanotic? Well, what does cyanotic mean? Skin color that is blue or gray. Medical terms are made up of roots, prefixes, and suffixes. So we need to be able to kind of dive in a little bit about this, and you should know some of this. So, it's like going back to English classes, and I hated personally having to learn root words, prefixes, and suffixes, and when I had to go back to school before. But it's actually very good to know to be able to understand something, because if we know the root words, if we know the prefixes, what are suffixes, it's going to make us a better communicator. So a root word is a part of a word that contains the basic meaning of the word or the definition of the word. The prefix, just like as it says pre, meaning precedes, okay? A prefix is the word part that precedes the root to help form a new word. Henceforth, before, okay? It's before the root word. Now the suffix is the word part added to the end of a root that helps form a new word, okay? So it depends on what goes on. If you want to add, like for example, let's talk about hypertension. Hyper meaning what? Extra, higher. Tension, tension. So that means it's a higher tension. So when we say hypertension, that means the person's blood pressure is elevated. It's higher. Whereas if we said hypo meaning low or below, if we say hypo, meaning that is the prefix, then tension is going to be the root word. That is, hypotension is a low blood pressure. Now, abbreviations are another way to communicate more efficiently with other caregivers. If you're in a healthcare setting, if you're a medical home health agency and you work for one, then there's going to be certain abbreviations. Now, each agency are going to provide you guys with what are the approved abbreviations to be used in charting, okay? And we want to be able to make sure we use the approved ones. Nowadays, with all these text messaging that we're trying to say SMH, which I just learned the other day means shaking my head, or LOL, laughing out loud, we are not using these words, these abbreviations that we use when we text message each other when we're charting for a patient, okay? So we need to be able to use approved abbreviations only. So an example of an abbreviation is PRN that is approved, right? Means as necessary, as needed. it is very important to learn the standard medical abbreviations that your agency uses, okay? Remember, abbreviations help healthcare workers communicate more efficiently. Efficiently because we're trying to save some time by not having to write as needed. Imagine if you had to write as needed several times. By just putting PRN, everyone already understands what it means. We should also understand that depending on where we work, we also need to report any things that occurs, such as falls, chest pains, severe headaches, difficulty breathing, any abnormal pulse and respirations or blood pressure, as well as any change in mental status. Any sudden weaknesses or loss of immobility, high fever, loss of or change in consciousness, any bleeding, any change in condition, any bruises, abrasions, or other signs of abuse. We need to be able to make sure that we use oral report to discuss your experiences with the clients or the family members and your observations of the client's condition. Use facts, not opinions, when making these reports. So why should we always be reporting things that are different or something that we're not used to seeing with the patient? The reason for that is, remember, they want to stay home longer. And your job is to keep them comfortable at their homes. And if we can address any issues now than later on, when the patient has to go to the hospital, it'll be a lot better for the agency you work for and for you. Because remember, when you're a home care aide, when you're a home health aide, this one person may be your full-time job. And if they end up in the hospital, well, where does that put you? So for oral reports, write notes so you do not forget to report any details. Do not rely on your memory alone. Don't wait 24, 40 hours and then start charting. Chart right there and then. Okay? Chart right there and then. Also make sure, following an oral report, document when, why, about what, and to whom an oral report was given. You always want to protect your assets, as my director of nursing used to teach us before. Your assets meaning your rear and your money. And making sure that you report depending on your policy procedures is an important thing. Now, when we create an oral report, when we give an oral report, when we document the following, we want to be able to document when was it made, why it was made, what it was about, and to whom the report was given. This will cover you in every aspect of things. All right, let's look at objective and subjective information, okay, and as well as describe how to observe and report accurately. So objective information are the information based on what a person sees, what they hear, what they touch, or what they smell. Subjective is information that a person cannot or did not observe, but is based on something reported to the person that may or may not be true. Now, pertinent information is significant or useful. So, looking at this, smell, resident's body or breath odor. Sight, changes in resident's appearance. Hearing, resident's words, tone, and breathing. Touch, resident's skin and pulse. Okay? So these are what? Subjective or objective? It's, of course, going back, objective information because you can see, you can hear, you can touch, and you can smell. All right, knowing how to use the 4 different senses when observing and reporting. Number 1, smell, sight, hearing, and touch. How do we do that? Well, using the sense of smell when observing and reporting. Do you notice any odors from the client's body? Odors could suggest inadequate bathing, any infection, or even incontinence. You may breathe odor. Breathing odor could suggest use of alcohol or tobacco, indigestion, or even poor oral intake. Odors in the home may suggest house cleaning is needed. Food odors could indicate any spoilage. All right, sense of sight. Look for changes in the client's appearance. These may include rashes, redness, paleness, swelling, discharge, weakness, posture or gait changes, or even sunken eyes. Look for changes in the home. Does the home appear disorganized or dirty? Is food needed? Do safety hazards exist? Hearing. Listen to what the client tells you about his or her condition, family, or needs. Is the client speaking clearly and making sense? Does the client show emotions such as anger, frustration, or sadness? Is the area calm and quiet enough for your client to rest as needed? Is the breathing normal? Does the client wheezes? Do they gasp or do they cough? Now, when we talk about touch, does the client's skin feel hot or cool, moist or dry? Is the pulse rate normal? Use your sense of touch to test bathing waters at the home, because you want to be able to make sure that you don't scald them. Also pay attention to heating or the cooling system. Is it too hot for the client? Is it too cold for the client? Now, remember, when we're observing a client at their home, we're not just observing and caring for the client itself. We must observe them, the family and friends that surrounds them when they come in and visit and see what's in there, the environment, as well as the environment in the home structure, making sure that there's nothing in the home that could cause problems or danger or accidents for the client. Using all your senses will allow you to make the most complete report of a client's situation. Okay, moving on. Incontinence. You're going to hear this a lot in the home care setting or in the healthcare medical setting. Incontinence is the inability to control the bladder or the bowels. Unfortunately, some clients eventually are going to have problems, and will have episodes of incontinence where they may urinate on themselves or they may accidentally defecate on themselves. We need to be able to make sure that we pay attention to that. Now, talking more about current documentation and the essentials of it. What happens is it guarantees clear and complete communication. It provides that legal record of treatment if you're a skilled nursing home health agency. It also protects you as a home health aide or a caregiver and an employer. Remember, in the medical setting, if it's not written, it wasn't done. If it wasn't documented, it wasn't done. It wasn't provided. And we need to be able to provide up-to-date records of clients, the status, and their care given to them. If something does not appear in a client's chart, it did not legally happen. Like I said earlier, if it wasn't written, it wasn't done. Failing to document your visits with clients could cause very serious legal problems for your agency, whether it's medical or non-medical, because if you didn't document it, somebody questions that you didn't show up and you didn't document your visit, well, guess what? The company may not get paid. And if the company doesn't get paid, you don't get paid. Okay? And you don't want any problems with that. So, what is it meant by the phrase, if it was not documented, it was not done? I said that twice. Why is knowing this important? And remember, I told you already, but why is it important for you? Now, we talked about skilled nursing, home health services. Their charts are very confidential, okay? Remember about the HIPAA policy that we discussed early on. The confidentiality of the patient's information is a must. Okay, talk about visit records and incident report. Visit records are the progress notes or the clinical notes that serve as a record of a home health aide's visit and the care provided. They also include observations of the client's condition, the changes, or the progress. The incident report is a written report documenting an accident or other significant event that occurs during a visit, also known as an occurrence report or even an event report, depending on the agency you work for. So you want to be able to know these rules for writing visit records. Document care immediately after visit, think before documenting, use facts, not opinions. Write neatly in black ink, not blue ink, red ink, pink ink, purple ink, whatever color you want to use, black ink is always a must. Correct errors properly, never use any whiteout, okay? Once you write on it, it is a documented item, you can only cross over it. You want to sign your full name, your title, and your date. You want to be able to document according to the care plan provided. Okay, do you guys know how to tell time? I'm sure, and I hope by now you do. But one thing in the medical field or the healthcare setting is we like to use military time. So you want to be able to know how to write military time. So if it's 6 o'clock or 6 o'clock in the afternoon or 6 p.m., it's always going to be 1800, meaning 12 hours has passed plus 6. If it is 8 o'clock in the morning, you're going to say 8 o'clock, 800. If it is 8 o'clock at night, it is 2000. Because if you take 2000 minus 12, which 12 already passed in the morning, that's 8 is left. You need to be able to understand how to convert regular time to military time. To change the regular hours between 1 p.m. to 11:59 to military time. All you have to do is add that 12 to the regular time. Okay? Remember, minutes and the seconds don't change, just the first 2 digits. Midnight may be written as 4 zeros or even 2400, depending on the policy of your company. So the following are considered incidents and require that a home health aide complete an incident report. Those are your falls, your damages, mistaken care, requests that are out of the scope of practice, blood or body fluid exposure, injuries, sexual advances or remarks, or even unsafe situations for you or for the client or patient. You will spend much more time with each of your clients than any other member of the care team will. And because of this, you may notice things about your client that other nurses, the doctors, or therapists don't even know. So remember, you will not diagnose or recommend treatment. However, your observations will provide a lot of valuable information about your client that will help the other people, the physician, the nurse, provide care for them. So what can you, as a home health aide, contribute to a care planning conference? Information. You're there, remember? You have the eyes and the ears. You can provide them information, vital information, because you're always there. Okay. You need to know these steps for making a call to your supervisor. 1. Always identify yourself. Don't expect them to just know who you are by the sound of your voice. You need to be able to ask for that person. Speak to the supervisor. Identify yourself again and say why you're calling. If not available, leave a message. By now, the thing to do is always leave a message when you call someone and you get their voicemail. It is proper etiquette. Your message should be brief and clear. Don't give them a full narration on the video, on the message, okay? And always thank the person. It is important to always thank someone. Now, there may be times where you may also need to answer the phone for your clients and know how to take messages. Remember the following steps when answering the phone. When answering calls for the client, always identify yourself and your position first. Be sensitive to the client's privacy. Don't ask for more information than that the client actually needs to return the call. A name, a phone number is enough. Do not give out any information about your client. Write down the name and the phone number of the caller. Tell your client about the call. Now, think of problems that could occur in telephone messages and actions to prevent or correct them, such as in the following situations. Message never gets to person called. Home health aide forgets to ask who they left message with. Call is disconnected. You cannot fulfill your end of messages plan. Remember, message never gets to the person called. Meaning that when a person called, you didn't get their information, you forgot to give it to the client, to the patient. Or somebody calls, you tell the client, hey, somebody called for you. They ask you, who called for me? And you don't know who called. Even worse, you didn't take the phone number down. You need to understand that there is going to be problems with communications, but we need to prevent things by gathering more information and more data. That is how we can provide better care and provide better communication. Okay, moving on to cultural diversity and religious differences. Cultural diversity is the variety of people living and working together in the world. And the bias is prejudice. Just another word for prejudice. And we need to understand that, especially living in the United States or Canada or Puerto Rico or any other U.S. islands or even Europe, that we are living among a diverse culture. There's different cultures that surround us. And we need to understand that we need to be able to work together to be able to provide great care and to provide great services. So we need to understand some of the basic information about the following religions or beliefs. You need to look into Buddhism, Christianity, Hinduism, Islam, Judaism, spirituality, Native American spiritual traditions. These are important things for us to know. And also to understand that if we have differences in religion with the person we're caring for, we need to respect their religion. Because remember, we're there for them. We need to understand that we need to be able to respect them as a person. If they have prayer times, make sure that they actually are able to be given time for this. We need to really look into that and show that we respect them as a client. So, are any of these religions practiced by you or your friends, the different religions I just showed you in a previous slide? If yes, share some of the practices with the class. Okay, how can religious and cultural differences affect the home health client relationship? If you can't share with the class because you're taking this on one of our online courses, or let's say, for example, that you want to be able to look into things further, just research the different religions out there on the previous slide. And let me just go ahead and I'll go one slide back so you guys can see it again. Buddhism, Christianity, Christianity, Hinduism, Islam, Judaism, spirituality, Native American spiritual traditions. Make sure you kind of look into those and know what are important things on each aspect of the cultures. Now, moving on to other terms in regard to cultural diversity and religious differences, we also have the agnostics and the atheists. Some people think that these two things are the same when they're not. Agnostics are people who believe that they do not know or cannot know if God exists. Atheists, people who believe that there is no God. Big difference. So remember, agnostics and atheists' beliefs may carry as much meaning to people who identify themselves as agnostics or atheists as religious beliefs do to people who identify themselves as belonging to a particular religion. So if a person is agnostic or an atheist, don't push your religious beliefs to them. So if your client is an agnostic or as an atheist, you may want to respect that also and respect their beliefs, because that is a belief as well. It is extremely important that you can and you should accept and respect, not judge, the client's personal belief. Okay, moving on to more stuff about cultural religious differences, dietary restrictions, fastings, and vegans. There's a lot of changes, a lot of differences. Dietary restrictions, rules about what and when individuals can eat. Fasting, not eating food or eating very little food at times. Vegans, these are vegetarians who do not eat any animal products, including milk, cheese, other dairy items, or eggs. Vegans may also not use or wear any animal products, including wool and leather. So what are some possible dietary restrictions of clients? How could they be a challenge in providing proper nutrition? One of the things, for example, a good way to look at it is vegans, for example. They're not eating meat. And what is in meat? Protein. So we need to be able to balance their dietary intake by giving them vegetables, fruits that are of higher protein balances. So do you, as you're watching this video, follow any particular diets due to religious or personal beliefs? And I want you to think about that, because if you do, for example, how would you feel if somebody does not respect that? So that same feeling you need to understand is that you need to be able to show respect to others as well. Now, cultural backgrounds affects many things and includes the following: physical contact, physically expressive versus not wanting to be touched, how friendly people are to strangers, for example, how clients feel about you performing care for them or discussing their health with them. There may be a time where somebody says that they don't want you caring for mom because you're a guy, or they don't want you caring for their dad because you're a girl. So we need to be able to understand some cultural and religious differences and respect that, and need to report that to our supervisors and our managers as well, so that they are aware of what's going on. So we talked about combative earlier. You may face this, and it may happen. So what is combative? They're a violent or a hostile behavior. Now remember, these ways of coping with combative behavior. You want to block physical blows or step out of the way if this is being done to you. Okay, but you never ever hit back. Allow the patient, the client, time or space to calm down. You want to be the person that remains calm in this moment. If somebody else is going crazy and you go crazy as well, it's not a good situation. You need to be the person that can hold on to calmness. You must remain calm. You must be flexible and as well as patient. You want to be able to stay neutral. Do not respond to the verbal attacks. Do not use gestures that could frighten or startle the client. Be reassuring. I'm here for you. Consider what provoked the client. Did you do something that caused problems? We talked about verbal and nonverbal. Some people don't even understand that they did something that caused the other person to get mad or get upset. So some of the inappropriate behaviors will include asking personal questions, requesting visits on personal time, asking for favors, giving gifts and tips, lending or borrowing money, asking home health aide to perform tasks not on care plan, making sexual advances. So some of these are the inappropriate behaviors that may be done by a client or a patient to you. And we need to understand that there are boundaries there. So remember, don't go personal stuff. Don't start sharing with them the world about you. Okay? You want to be able to avoid that. Remember, we want to care for the client, but we're not here to get too personal. You don't want to, if they ask to borrow money from you, don't lend any money. Okay? I've seen it happen in the past where people are caring for someone and they just care for them so much. If they needed some money, they lend them some money, but they never get paid back. So the thing is, just don't avoid any exchanges. Don't give money. Don't ask for money. Now, we want you to also understand several ways to handle inappropriate behaviors. If any inappropriate behavior is done towards you, you want to be able to address the behavior with the client themselves, but if you feel uncomfortable, be able to talk to your supervisor. But always report this as well. If there's any inappropriate behaviors that is occurring, make sure that this is reported automatically. You want to be able to refuse gifts. Best way to avoid this is tell them that thank you so much for the gift that you're giving me. Thank you so much for this thing right here. But due to policies and procedures, we're not allowed to accept any gifts from patients and clients. That is the best way to respond to someone trying to give you a gift or a tip. And remember, like I said, always report to your supervisor. Okay, so this is going to be your first exam that you're going to be taking. So take your time in taking this exam, okay? And you don't have to have a perfect score. If you make a mistake on any of the questions, it's okay. Our goal is to eventually be able to give you the information and to be able to make sure that you have the knowledge on how to be able to approach any situation as a home health aide, as a home care aide, as a homemaker in this industry. So good luck on the exam. I know you're going to pass. I know you guys have passed and will pass. So if you need time, just go ahead and rewatch the video again. If not, go ahead. Good luck with the exam, and I'm sure you're going to pass.